Also, welcome, Doctor.
Happy
New Year.
Happy New Year.
Yes, Happy New Year.
This is the first time we are seeing you.
Yeah, good morning. Happy New Year.
School have resumed,
Yes.
and what do you have to tell parents this morning, and what's your topic for today for us?
It's still on childhood eye care
Okay.
and caring for children's eye health, especially now that school has resumed. Okay, good morning, everyone. Happy New Year. Thank God for the new year. I'm Dr. Mrs. Eseroghene Ihasuyi, your optometrist and eye doctor. So I'm here to talk about caring for the eyes and sight of your children. School has resumed quite all right, and there are many ways that parents make themselves ready and make the children ready for resumption. But how about their health and their sight? Without proper sight, it will be difficult for that child to learn. Studies have shown that the child's academic performance is directly related to the child's visual performance. If the child is not performing at optimum level and visually, then the child will not be able to perform at optimum level academically. So how will you be able to do that? If your child has any complaint, even without any complaint, take your child as you get new school bags, new shoes, get certain things that are already worn out or old, or you need to get new uniforms and all. Also take your child for a medical checkup to check how healthy this child is and how fit this child is for school. Also for an eye test too, to see how visually ready this child is for school. Some children may not give the complaint because they don't know how to express themselves to be able to tell you what they are experiencing. They may even think that that's how other children see things or how other children feel. Some may be able to express themselves to you and tell you, I have pain, I can't see the board, I can't see my book. Or you yourself, you'll be able to observe in the child that the child is always bringing out tears from the eyes, always trying to go close to the TV to see, always rubbing the eyes, scratching, or the eyes get red. You yourself may notice some of these symptoms, or you may not, or the child may not. So just take it as part of your back to school plan. Take the child for an eye care test. Let the doctor of the optometrist have an eye test on the child just to see, just to certify, to be sure that that child is visually fit for school. Many teachers complain that this child I've seen many teachers complaining that the child is not performing optimally. Probably the child does not understand, or the child is too playful, or most times when we carry out an eye test, find out that the child was not even seeing the board. When you interrogate the child and ask the child questions, deep questions, just be friendly, because some children may not want to open up to you. Or make yourself, friendly to the child. The child will open up to you. I can't see the board clearly. Or my book, when I'm reading, I begin to see double. Or tears come out from my eyes. These are obvious complaints that may affect the child academically, and the child will not be able to express themselves, or they will express themselves. So have the child tested. And now another issue is that many times we've seen parents, when they bring the children in for an eye test, when we tell them the treatment options, the parent may object to it. For example, if we tell the parent this child will need to use drugs for or certain kinds of drugs, they say no. Please, instead of an eye drop, give the child a tablet, or instead of a tablet, give the child an eye drop. Or we tell the parent this child we need glasses to help him see clearly. No, in our family, nobody has ever used glasses, so we can't. When the doctor is the one telling you that for this child's problem, he needs glasses to see clearly. So please, parents, make yourself open to the treatment options that the doctor is giving you. Whatever treatment that the doctor is giving you for your child, please accept it and adhere to it. Ask questions. If you're not clear or you're not comfortable with it, ask questions. There are some treatments that alternatives may be available, and the doctor will also make them available. Will also let you know if there's an alternative to that form of treatment that you're objecting to. But if there's no alternative and that is the only way that the child will do better, please accept that treatment and adhere to it. Help the child's sight. You are the parents, you are the one to help this child use this medication. Of course, children may be absent-minded, they may not want to use their drugs, they may forget the glasses, get it missing. Help the child by, keep these drugs safe. If it's eye drop, if it's tablets, keep it safe. If it's glasses, always ask the child, where's your glasses? Okay, keep it safe. Instruct the child. Of course, in clinic, doctor will always instruct the child that these your glasses needs to be kept safe for you to see clearly. Don't be rough with it. So also you, the parents, also have a role to play in that too, in helping the child's medical aid be kept safe. The glasses, the drugs. We've seen cases where an eye drop is given to the child to take to school and the child didn't bring it back, of course. This happens. So you need to instruct the teacher that, auntie, please, this child will be using this eye drop during break time or at social time. Let the teacher also be involved in the treatment. Because if you don't let the teacher know, the child will just take it to school and show his friends that this is a new toy and they may play with it. Or the glasses, let the teacher also be involved. Because in caring for a child's eye, it's not only the child that is doing it. You, the parents, the teacher, and every other caregiver or every other adult around will also be involved in it. And all these things are what we have to put together to help our children see clearly in this new term. If you want a child to perform academically at optimum level, giving you grades that you want, also help the child to see the board clearly, see their books clearly. Many other complaints also come in. Now, there are some other conditions where we have, conditions where the option treatment may even be something deeper, like surgery and all. Please make yourself available.
All right, Doctor, I want to ask this question. For children having high problem at tender age, what do you think is the cause? The food, or is it hereditary? What do you think is the cause of this?
Okay. Eye problems at tender age are of different causes. Various reasons may cause it. The number one reason may be a hereditary. It may be that the parent themselves didn't have that issue, but a grandparent or a great-grandparent has it. The way we appear and the genes we have in us is not just from our direct parents, it's from our grandparents and great-grandparents. There are some recessive traits that wasn't dominant in our parents, or even dominant in any of our siblings, or will just be dominant in just one child. So a recessive trait that was passed down from one of the ancestors may just manifest, and that trait may just eventually be an eye problem, e.g. glaucoma, cataract, and many other conditions that happen like that, retinitis pigmentosa. There are many various conditions that may result from a genetic connection. And also myopia, hypermetropia, that's conditions that require glasses, long-sightedness, short-sightedness, astigmatism. These conditions require the use of glasses. Now, they may also be inherited too. Now, apart from that, our diet, if the mother didn't feed well during pregnancy, had lacked vitamin A in her diet, it may also affect the child's eyes. And if the child, during the developmental stage, also at the very tender age of before 1 year or infancy and adolescence, the child didn't feed properly, it may also cause.
When you say feed properly, like what should be considered in the children's diet?
Okay, balanced diet, fruits, vegetables are very, very necessary. If the mother is nursing the baby, she herself needs to eat healthily for the child to have these nutrients that the child needs.
Okay, during when the woman is pregnant.
When the woman is pregnant, she
when
needs to
it
eat healthily. Yes,
Okay.
and also be careful of the herbal concoctions she
that
takes.
taking.
Yes, of course, in Africa here, we believe in our herbal concoction, herbal drugs for pregnant women. They say it makes the child strong and all. There are some women who have used very, very harsh ones that eventually caused cataracts in the child's eyes, and we may even make the child develop in an abnormal way. So be careful of the herbal concoctions you take during pregnancy. Medically, we don't encourage that, because if you are pregnant, go for your antenatal appointments, see the doctor. They will give their medications that women take, and folic acid, blood capsules, and all. They will help you be healthy. So if you are going to take herbal concoctions, we don't advocate that. We don't advocate this.
I want to stay on this when some parents will say, oh, my parents didn't use glasses, I'm not using one, so you shouldn't use one. So we get to as far as getting only water to be washing the child's eye when the child is complaining that, oh, I have blurred vision, I cannot see. So what do you have to tell such parents if a child is having such experience?
Yes, if your child is having any complaint and you want to, we are all people of faith, we are Christians, we also believe in God, we believe in the power of God, or else we will not have the boldness to do what we are doing as medical practitioners. We know that it's God that heals, but we just treat and we give our treatments, and God heals eventually. But if you have a child that has a complaint, see the doctor. Let the doctor make the diagnosis and give you drugs or treatment for the child's eyes. You can also pray. Of course, when you are using your medication given to you, you pray, because without God, the medication won't even work. So also pray. If you are a person of faith, also pray. Drink your holy water, but don't depend on that, please. Use your medical treatments. Use medical treatments. We, as even medical doctors, as optometrists, as healthcare givers, we also pray for all our patients when they come in that they get better. So if you have any complaint, if your child has any complaint, don't just keep using holy water, olive oil, breast milk.
Is it olive oil to wash the eyes?
The eyes, yes.
Some use urine.
That's very bad.
Okay.
Please
Yeah,
don't
babies
use all of
and
this.
eyes.
See your doctor and use the medical treatment given to you.
Thank you,
very
Dr.
much.
And very last question. What about those children? They'll bring them out to expose their eyes to the sun.
Okay, no, looking directly at the sun is very, very bad.
Okay,
No.
all right.
No, in the morning.
It depends on
We'll
the health
continue
condition.
from next week. Our time is. Thank you,
Okay.
Doctor, for that. Daybreak, we have this conversation next week, Tuesday. Thank you for staying with us on this edition, Tuesday's edition on Daybreak. We are glad you did. I'm Josephine Eimie, and my co-presenter with me,
Okay, I'm Peggy Ihuari. Have a productive day.
Dr. Ihasuyi. Thank you.
Thank you.
All the way from Clarice High Care.
Yeah.
Thank you so much. Do have a good day.